In progress.
Hello, everyone, and welcome back to Pass MA with Danny. If you're getting ready to take the certification exam, you guys are in the right place. I'm Danny, and today we're going to go over some of the most commonly tested concepts that you'll see on the exam. We're going to go through some practice questions together, break down the rationales, and talk about why the correct answer is right, not just memorize facts. So I want you guys to remember that the exam itself is not only designed to test your understanding, but also to test your critical thinking. So I want to go ahead and start sharing tips on how to eliminate wrong answers and how to recognize those little clues on the exam that they like to hide within those questions. So whether you're testing tomorrow, next week, or you're just kind of beginning to review, my goal is to help you feel more confident by the end of the session. So I want you guys to go ahead and grab your notebook, pause the video at any time where you need to think through the questions. And I know that I kind of transition between question and answer, maybe a little bit quickly. So after I finish the question, make sure that you guys do pause so that you get a chance to kind of think about and process the question with the answers. So that way you can select before you see the final. All right, so let's go ahead and jump into today's review. And just remember, you got this. All right, here we go. Question number one. When performing a capillary puncture on an adult, which of the following is the appropriate site? Is it going to be A, the earlobe, B, the ring finger, C, the heel, or D, the thumb? All right, here we go. If you said B, the ring finger, then you are correct. So I want you to think about what makes a good capillary puncture site. You're going to need good blood flow, thin skin, and an area that isn't too sensitive or calloused. The ring finger or the middle finger of the patient's non-dominant hand is going to check all of these boxes. Now, I want you guys to remember the middle finger itself is considered to be the third digit, okay? The ring finger is considered to be the fourth digit. So make sure you remember that because they may phrase it, which digit is the appropriate site, third or fourth. The third is the middle finger, the fourth is the ring finger. And you want to make sure that you are using the patient's non-dominant hand. Well, if you're wondering, well, why don't we use the thumb? We rule out the thumb because it actually has its own pulse. And this would interfere with the readings. And also on your thumb, think about it, your skin is a bit thicker. Now, they also give you an option for the heel. Now, you might say, okay, well, the heel sounds like it could be right because remember, we do use heel sticks, but never for adults. We only use heel sticks on infants. So I want you guys to remember that. Another thing to remember when it comes to a capillary stick that you may run across on your exams. They may ask you, is it ever okay to use the first drop of blood when performing a capillary stick? Or they may say dermal puncture. The answer is no. We never use the first drop of blood. Always wipe away the very first drop. The reason for this being that first drop can be kind of mixed with residual tissue, but also skin bacteria, and this can actually compromise the test results. All right. Question number two, which of the following is a sign of hypoglycemia? Is it A, flushed skin, B, tremors and sweating, C, a slow heart rate, or D, dry mucous membranes? Hypoglycemia. For question number two, if you said B, then you are correct. Tremors and sweating. So basically, when blood glucose drops too low, the body then starts to release adrenaline as an emergency signal. The adrenaline causes all of the classic low blood sugar signs like shaking, cold sweats, rapid heart rate, pallor, and even anxiety. I want you to think of this as your body's literal sounding alarm saying, hey, I need sugar right now. The other options that can trap you, flush skin, dry mucous membranes, and a slow heart rate. These are actually signs of the opposite. Those are signs of high blood sugar, which is hyperglycemia. So when we look at our term, and let me get my little pen. When we look at the term hyper, remember hyper is our midterm for above, right? So if a patient has hyperglycemia, they will have high blood sugar. Now, on the exam, you must know the difference, right? So, as a reminder, low blood sugar means shaky, sweaty, pale, fast heart rate. High blood sugar will be flushed, dry, thirsty. Now, also, you need to know the range of actual blood glucose levels. Now, a normal fasting blood glucose is going to be between 70 and 90. Anything below 70 is considered to be hypoglycemia. Anything above 99 for a fasting blood glucose is considered to be hyperglycemia. So make sure that you guys do remember this reference range for the exam. All right, a patient's blood pressure is 142 over 92. How should the medical assistant classify this reading? Would it be A, normal, B, stage 1 hypertension, C, stage 2 hypertension, or D, hypertensive crisis? Again, 142 over 92. Now, for question 3, if you said that that is stage 2 hypertension, then you are correct. Now, a normal blood pressure is going to be 120 over 80 or below. Elevated is considered for the systolic, remember that's the top number of the blood pressure, to be between 120 and 129. The diastolic is elevated between 80 and 89. Remember, diastolic is the bottom number of the blood pressure. Now, anything 140 over 90 or above is considered to be hypertension, high blood pressure. All right, let's go ahead and look at question number 4. Which of the following is the correct angle for a subcutaneous injection? Is it A, 10 degrees, B, 45 degrees, C, 90 degrees, or D, 15 degrees? For question number 4, if you said B, 45 degrees, then you are correct. The route of injection determines the angle, and this is something that the certification test, whether you are taking NHA, AMA, it does not matter. You guys are going to see this regularly. Now, here's going to be your cheat sheet. Intradermal, ID injections, think of TB, think of allergy testing. Those go in at a 10 to 15 degree angle, kind of almost flat against the skin, right underneath that dermis layer of the skin. When we're talking about subcutaneous or sub-Q, think of allergy shots, insulin. The angle of insertion for sub-Q is 45 degrees. Well, how do you know what a 45-degree angle is? I want you guys to imagine yourself drawing a triangle, okay? A side of a triangle is a 45-degree angle. So if you're unsure specifically of what a 45-degree angle is, just think of that side of a triangle, okay? That's going to give you your 45. Now, some subcutaneous injections can go in at a 90-degree angle. Think of insulin pens like Wegovy or what is the other one? I cannot remember the name. Wegovy. What is the one that everybody's using right now? Can't remember the name of it, but there are insulin pens that do go in at a 90-degree angle. And then patients that do have larger arms, we also go in at a 90. But for the certification exam, you guys are saying subcutaneous is 45. Okay, remember, side of a triangle, that is your 45-degree angle. Now, if you're asked about IM injections, remember, IM is intramuscular. Now, when we're doing an intramuscular injection, I want you to think that this is going directly into the patient's muscles. So it's bypassing the dermis, it's bypassing sub-Q, and it's going into the muscle. 90-degree angle, think of shooting a dart. Okay, intramuscular goes straight into the muscle. Straight. There's no tilt or slant to that needle. It goes in at a 90-degree angle. All right, question number 5. A medical assistant is reinforcing teaching with a patient who has a new prescription for nitroglycerin sublingual tablets. Which of the following instructions should be included? A, swallow the tablet whole with a glass of water. B, place the tablet under the tongue until it dissolves. C, chew the tablet thoroughly before swallowing. Or D, take the tablet on a full stomach only. All right, for question number 5, if you said B, place the tablet under the tongue until dissolved, then you are correct. Now, the word sublingual literally means under the tongue. And this is the definition in Latin. I want you guys to remember that when we're looking at medical terminology, it's not based around the English language. Medical terminology derives from both Latin and Greek. So sometimes we may look at terms and like, okay, what is this referring to? But just remember, it's because it's from Latin and Greek origin, not English. Now, talking about sublingual, this is under the tongue. Okay, the tissue under the tongue is packed with tiny vessels that absorb the medication directly into the bloodstream. There's no digestion needed. This is why this medication usually works really fast, in approximately like 1 to 3 minutes. And this is exactly what you're going to need when someone is having maybe chest pain from angina. If the medication is taken orally, swallowing it, then it goes through the digestive system and it has to metabolize through the liver. Now, the liver has to break this down through metabolism before it can actually work. So, this is why sublingual under the tongue works faster. It goes directly into the bloodstream and it bypasses that process of metabolizing. All right, question number 6. Which of the following urine colors is most likely associated with the presence of blood? A, straw colored, B, amber colored, C, cloudy white, or D, reddish brown? For question number 6, if you said D, reddish brown, then you are correct. Now, when blood gets into the urine, we call this hematuria, and I want you guys to remember this med term, okay? Hematuria. Even just a small amount can turn urine color, can change it to a little bit of a pinkish color, a reddish color, or even a reddish brown. Now, we can see hematuria occur with patients that have kidney stones, even a UTI, a bladder infection, kidney disease, trauma, or if you have a menstruating patient. If a patient is currently menstruating or has recently finished their menstrual cycle, then blood will be present. All right. Next question, number 7. When preparing a patient for an EKG, which action should the medical assistant take first? A, apply the electrodes. B, clean the skin with alcohol wipes. C, turn on the EKG machine. Or D, explain the procedure to the patient. Now, as you guys are starting to do practices, I want you to look for what we call qualifiers. Qualifiers are also known as keywords, okay? In this particular question, they're asking you what happens first, okay? Sometimes on the exam, you may see a question where there's 4 correct answers. This question is not asking us if all 4 of our options are correct. It's asking us, what do we do first? So we have to identify order of operations when performing an EKG. What is the very first thing that we do out of A, B, C, and D? So if you said D, explain the procedure to the patient, then you are correct. Patient education always comes before any hands-on steps. This is going to be the principle that applies across all clinical procedures on your exam. The reason that this matters specifically for an EKG, you may have a patient that could possibly be anxious, tense, or confused. They can actually start to move around because of that nervousness or just being unsure. And they can actually kind of tighten up and contract their muscles. If this happens, you're going to see a somatic tremor. This is an artifact that will occur on the EKG. It's kind of like jagged, chaotic lines. This is going to make the tracing unreadable. We're going to see a somatic tremor and not the conduction of the patient's heart. So if you spend that extra minute or 2 explaining what you're doing to the patient, you're going to reduce their anxiety. You're going to get them to hold still. And this can improve the quality of the recording. So when we talk about the order of sequence from the options that they gave us, number 1, always explain the procedure. Then we're going to go ahead and clean and prep the skin. Apply the electrodes, then connect the leads, turn on the machine, and then get the tracing. All right, question number 8. A provider orders a throat culture. Which of the following is the correct technique for specimen collection? A, touch the back of the tongue to collect the secretions. B, swab the posterior pharynx and the tonsillar areas. C, swab the inside of the cheek. Or D, collect saliva from the floor of the mouth. For question 8, if you said B, to swab the posterior pharynx and the tonsillar areas, then guess what? You are correct. The bacteria that causes throat infections like strep live specifically at the back of the throat on the tonsils and the posterior pharynx. This is kind of like back kind of towards the back of the wall of the throat. Now, your swab has to physically reach that area to collect an accurate specimen. The biggest mistake to avoid is touching the tongue. Why? Why can we not touch the tongue? This is because the tongue is covered completely in normal mouth bacteria. Now, these bacteria have nothing to do with strep or throat infections. But if that bacteria gets on your swab, guess what? It's going to contaminate the specimen, and the lab results then become meaningless. This is going to lead to the wrong diagnosis and also the wrong treatment for your patients. You also want to stay away from the cheeks and the floor of the mouth because they have the same problem. We have normal oral bacteria, and this can contaminate the specimen. So use a tongue depressor. Think of that as being like a medical popsicle stick. This is to hold the tongue down. Make sure that you have good lighting. Visualize the back of the throat, and you want to firmly swab both tonsillar pillars and the posterior pharynx. Remember, guys, to keep that swab away from the tongue, from the teeth, and from the cheeks. All right, question number 9. Which of the following abbreviations means before meals? Is it A, HS, B, PC, C, AC, or D, PRN? For question number 9, if you said AC, then you are correct. The answer is C, AC. Now, this actually means before meals. Now, there are a few terms that I want you guys to remember for your exam, okay? Again, AC is before meals, PC is after meals, HS actually can be at bedtime or hour of sleep. PRN means as needed. The term BID means twice daily. TID means 3 times a day. And QID means 4 times a day. You guys will actually see this throughout the exam. They will take med terms and kind of incorporate them in scenario-based questions. All right, guys, question number 10. A medical assistant is preparing to perform venipuncture. Which of the following actions should be taken to prevent hemolysis of the blood specimen? A, shake the tube vigorously after collection. B, use a small gauge needle and slow, gentle inversions of tubes. C, leave the tourniquet on for more than 2 minutes. Or D, allow the specimen to stand in sunlight to clot. Now, for question number 10, if you said B, to use a small gauge needle and slow, gentle inversion of tubes, then you are correct. Now, if you guys hear the term hemolysis, this is basically when red blood cells break open and kind of spill their content into the serum. So a hemolyzed specimen is rejected by the lab because it will actually give falsely elevated values, especially in potassium. So I want you guys to think of red blood cells like a very delicate water balloon. The more gently that you handle it, the less likely it's going to be to burst. Vigorously shaking can actually create mechanical trauma and destroy those red blood cells. So always gently invert the tube. Depending upon the tube, it may be like an 8 to 10 conversion where you kind of turn it slowly upside down and back. Don't shake it because that is what's going to damage the specimen. Another thing to remember, because you guys will run across this, the tourniquet cannot stay on for longer than 60 seconds. You cannot leave the tourniquet on longer than 1 minute. Hemoconcentration can occur if you do, and this can actually cause the blood to thicken. So tourniquet stays on no more than 60 seconds, okay? All right, next question, number 11. A medical assistant is preparing to measure a patient's oxygen saturation with a pulse oximeter. Which of the following is a correct step? A, place the probe on a finger with dark nail polish. B, position the sensor on a warm, dry finger. C, place the probe on the same arm as a blood pressure cuff that's inflating. Or D, ask the patient to move their hand during the measurement. All right, for question 11, if you said B, to position the sensor on a warm, dry finger, then you are correct. Now, the pulse oximeter works by shining 2 wavelengths of light basically through the fingertip and measuring how much oxygen saturation is present. A warm, dry finger is going to have good blood circulation, and this is actually going to allow the sensor to be able to detect a clear pulse wave and give an accurate reading. If a patient is wearing dark nail polish, especially like deep dark reds, black, blue, dark greens, these actually absorb the same wavelengths of light as hemoglobin, and it can cause the machine to read falsely. It may not even pick up a reading, or it may give an inaccurate low oxygen saturation. So always remember to remove any dark nail polish before applying the probe. Another thing to remember as well is that if your patient has cold hands, this can also affect the reading. Check the capillary refill on your patient's hands. If their hands are cold, this is going to mean poor circulation. Poor circulation is also going to lead to an inaccurate reading. It may not pick up the oxygen saturation at all, or it may give an actual lower reading than what your patient's pulse ox is. Now, I want you guys to remember the pulse oximeter measures two things. It measures the patient's oxygen saturation, and it also measures their pulse rate. A normal oxygen saturation is from 95 to 100. For an adult at rest, normal heart rate range, normal pulse, is from 60 to 100 beats per minute. All right, guys, next question. Number 12. Which of the following is a CLIA wave test that a medical assistant may perform in the office? Is it A, blood culture, B, arterial blood gas, C, a urine pregnancy test, or D, type and cross match? For number 12, if you said C, a urine pregnancy test, then you are correct. Now, I want you guys to remember what CLIA stands for because some of you may also run across this. CLIA actually stands for the Clinical Laboratory Improvement Amendment. Now, this is the federal law that classifies lab tests as being complex or more simplistic. This also determines who is authorized to perform them. Another thing you need to remember, not only what CLIA stands for, but you need to remember what tests are in your scope of practice as a medical assistant to perform. So I want you guys to remember this term CLIA waived. As medical assistants, it is in your scope of practice to perform CLIA waived tests. These are considered to be the most simplest category. Why is that? CLIA wave tests basically have the very low risk of error. They're FDA cleared, and you are authorized to perform these in an ambulatory care setting. When you think of a urine pregnancy test, okay, when you are taking a pregnancy test on a patient, you are looking for HCG. HCG is the pregnancy hormone. If HCG is present, it means that your patient is indeed pregnant. Okay. Now, when we talk about CLIA wave test, if you were to mess this up, it's not going to be damaging for the patient. It's not going to cause them harm. It's not going to be life-threatening. The test can be redone. Okay. When we talk about other tests that fall in the category of CLIA wave, think of a urine dipstick urinalysis. Think of rapid flu, rapid COVID, rapid strep, finger stick blood glucose, fecal occult blood, cholesterol. All of these fall under what we call CLIA waived. Okay. Again, these are in your scope of practice to perform as a clinical medical assistant. All right, guys, let's look at question 13. A patient reports severe chest pain and shortness of breath in the waiting area. What is the medical assistant's first action? A, check the patient's insurance information. B, obtain a detailed health history. C, activate emergency services. Or D, ask the patient to rate the pain on a scale of 1 to 10. For question 13, if you said C, to activate emergency services, then you are correct. Activate those emergency services, call 911 immediately. Now, severe chest pain combined with shortness of breath, this is a potential life-threatening emergency. This could be a possible heart attack, pulmonary embolism, or another critical cardiac event. In this type of situation, guys, every single second matters. In the absolute rule in any true emergency, and remember this even for future questions, patient safety will come before everything else. Insurance information, not during a life-threatening emergency, right? That's an administrative task that can wait. Obtaining a detailed health history. This is time consuming. This is going to delay emergency help. Rating the pain on a scale of 1 to 10, yes, this is important info, but you do not delay calling 911 to gather it. You guys can assess this while help is on the way. And then while you're waiting for EMS, make sure that you're staying with the patient. They're positioned comfortably, their clothes are loosened, and you have the AED located in case it's needed. All right, let's go ahead and look at question 14. When performing eye irrigation, which of the following directions should the fluid flow? A, from the inner canthus to the outer canthus. B, from the outer canthus to the inner canthus. C, from the top eyelid to the bottom eyelid. Or D, from the cornea directly onto the pupil. All right, for question 14, if you said A, from the inner canthus to the outer canthus, then you are correct. So we're talking about the inner canthus of the eye. And you guys, I want to be Picasso so bad, but I cannot draw to save my life. But we're going to go for it. All right, here is our eye. So we're talking about the inner canthus of the eye to the outer canthus. We're going to say this is the nose. The inner canthus is going to be the inner portion of the eye. So when we flush, we start from the inner portion and then we make sure that it flows outward. Okay? Start from the inner portion and flow outward. The reason for this being is that we actually do have a duct that's located in that little tiny drainage channel that connects your eye to your nasal passage. So if you irrigate backwards, if you actually start from the ear side, right, from the outer canthus, you're going to start pushing contaminants. This could be like a foreign body, chemical, whatever it may be. You can push it towards that duct and maybe potentially even into that cavity. Or you can push it to the other eye. So always flow from the inner corner of the eye to the end of the eye. Inner corner out. Okay? All right, question 15. Which of the following EKG artifacts is caused by patient movement? A, a wandering baseline. B, AC interference. C, a somatic tremor. Or is it D, an interrupted baseline? For question 15, if you said C, a somatic tremor, then you are correct. Now we talk about a somatic tremor. This is an artifact that is caused by skeletal muscular activity. Your patient shaking, your patient shivering, moving their arms, coughing, sneezing. If this is occurring during the EKG, the machine is going to pick up the somatic tremor artifact. This can kind of look like jagged or chaotic lines at the baseline of the EKG tracing. All right, question number 16. The medical assistant should identify that which of the following is a sign of infection at a venipuncture site. Is it A, slight bruising, B, warmth and redness, C, mild tenderness that resolves in a day, or D, a faint yellow discoloration after 48 hours? All right, for question 16, if you said B, warmth and redness, then you are correct. Now, these are two of the 4 classic signs of infection and inflammation that you guys need to remember. The 4 cardinal signs are redness, warmth, swelling, and pain. If you do see warmth and redness at the site, this is going to be the patient's body's response to more than likely a bacterial invasion, and it should be reported to the provider. All right, moving on. Question 17. Which of the following medications is classified as an anticoagulant? Is it A, furosemide, B, warfarin, C, metoprolol, or D, omeprazole? Again, an anticoagulant. For question 17, if you said B, warfarin, then you are correct. Now, warfarin is what we call the generic. It is also known as Coumadin. Now, this is an anticoagulant. So if we kind of break down this med term, okay, if you guys can see over here, anti is our term. This is our prefix. Remember, prefixes come at the beginning of a word. Anti means against, and coagulant means to clot. So if a medication is an anticoagulant, remember that it is against clotting. So when we talk about medications like warfarin, what do? they work kind of by blocking vitamin K. And I want you guys to remember this as well. Vitamin K is essential in the body for blood clotting. Okay. So again, warfarin works by blocking vitamin K. Again, your body needs this to produce several important clotting factors. So without the clotting factors working properly, the blood is actually going to take much longer to clot. So we have medications like warfarin, warfarin or heparin. These medications are classified as being blood thinner medications. Now, if a patient is on blood thinning medications, they actually do blood work. And the lab that is ordered for them is called a PTINR. Now, a PTINR is a test ordered to check the clot time. The provider may be checking to see how fast the patient's blood is clotting while they're on the blood thinner. All right, guys, question number 18. A provider instructs the medical assistant to collect a random urine specimen. At what time of the day should the assistant collect it? A, immediately after the patient wakes. B, 2 hours after a meal. C, any time of the day. Or D, the first voided specimen of the morning. Now, there's another word that I want you guys to remember because you're going to see it. Void. To void is to urinate. So if you guys see the term void throughout your exam and on questions, I want you to remember void is to urinate. All right. So for number 18, the answer is C, any time of day. So when you see the word random in a urine collection order, this is the instruction. Random means no specific time requirement. The patient collects whenever they need to go without any prep. They don't have to be fasting, and there is no waiting period. This is the entire point of a random specimen. It's the convenience and the immediacy. Now, other type of urine specimens, if it is a first morning specimen, first morning specimens are the ones that are best to utilize for pregnancy tests. The first morning specimen, we call it the first void of the day. This is the most concentrated urine specimen. Think about it. Your urine's been sitting in your bladder throughout the entire night. This is actually the best specimen to utilize for a pregnancy test. If you're doing a urine pregnancy test on a patient, remember, pregnancy tests are also called HCG tests. You are looking for HCG in the patient's urine. That's the pregnancy hormone. If pregnancy is detectable, that HCG hormone will be there. Best time to test for it, first thing in the morning when the urine is the most concentrated. Now, if you guys see a 24-hour urine collection specimen, remember a 24-hour collection is where the patient's collecting every single void. Remember, to void is to urinate. They're collecting every single void they have in a 24-hour period. Now, here's what to remember with a 24-hour urine. The first void of the day, the very first urine in the morning, that is the most concentrated one. That one is not included in a 24-hour collection. They may ask you on the certification test, for a 24-hour urine collection, when does the patient start? It's the second void of the day, the second urination of the day. Another thing to remember when it comes to urine is urine cannot sit out longer than 1 hour. Longer than 1 hour, urine goes bad. It actually starts to grow its own bacteria. So if a patient is collecting a 24-hour urine, they're giving a specimen collection container, but they're advised to keep it refrigerated. You'll have patients that are like, I am not putting my urine in my refrigerator. Guess what? That is okay. They can have a cooler over ice and keep the specimen container in there as well. Perfectly acceptable. All right, next question. Number 19. Which of the following is the normal paper speed for recording a standard EKG? Is it A, 10 millimeters per second, B, 25 millimeters per second, C, 50 millimeters per second, or D, 5 millimeters per second? Normal paper speed for recording a standard 12-lead EKG. All right, if you said B, 25 millimeters per second, then guess what? You are correct. Now, this is actually the universal standard EKG paper speed that's used around the world. And this actually does matter because the entire system for reading and interpreting an EKG is built around this number. So at 25 millimeters per second, each tiny small box on an EKG paper is 1 millimeter wide. And that one little small box represents 0.04 seconds of time. Now, the large box, which those little tiny boxes are inside of, those large boxes are made up of five small boxes. One large box is 5 millimeters wide, and that represents 0.20 seconds. All right, question number 20. When performing a venipuncture, the medical assistant notices a hematoma forming. What should be the next step? A, continue collecting the specimen until the tube is full. B, release the tourniquet and stop the draw. C, massage the area to disperse blood. Or D, apply ice after the collection is complete. For question 20, if you said B, release the tourniquet and stop the draw immediately, you are correct. A hematoma forming at the venipuncture site means that blood is actually leaking out of the vein and collecting into the surrounding tissue. So you can see or even feel it as like a firm raised lump that develops under the patient's skin. When this happens, patient safety takes absolute priority over completing the specimen collection. So you are going to release the tourniquet first, okay? Once you release the tourniquet, then you are going to remove the needle smoothly and in one motion. From there, you're going to apply firm direct pressure to the site with gauze and hold it without lifting for about 5 minutes. Don't even lift the gauze to peak, okay? Lifting it can actually break the forming of the clot. Now, after the bleeding is controlled, then you can actually go ahead and apply ice to reduce swelling. Here's the thing, never select massage the site. Okay, you are never massaging a hematoma. A hematoma is a bruise. If you massage it, this can actually force blood to go deeper into the tissue. That can make the hematoma or the bruising a lot worse. All right, question number 21. A medical assistant is reinforcing teaching with a patient about a Holter monitor. Which of the following statements should the assistant include? A, you may shower while you wear the monitor. B, keep a diary of your activities and any symptoms you experience. C, remove the electrodes each night before bed. Or D, the monitor must be returned within 7 days. All right. For question 21, if you said B, to keep a diary of your activities and any symptoms you experience, then you are correct. Now, the Holter monitor is basically a small portable device and it records the electrical activity of the heart. Now, the average time frame that patients wear them can be up to 48 hours, not a minimum of 24. It's going to be about 24 to 48. Now, you guys may find that patients will wear them longer for that time frame, just depending upon what the provider's looking for. But for exam testing purposes, they wear a Holter monitor between 24 to 48 hours. Now, the whole point of this monitor is to catch the patient's heart rhythm and any problems that only happen during specific activities. Think of going up the stairs, happening during sleeping, or even exercising. Now, the reason that the patient keeps the diary is so that the provider has a recording, not just the recording, but context to kind of explain what's happening when a patient is having an abnormal rhythm. Let's say at 2:30 in the morning, the patient's heart rate is about 150 beats per minute, consistently for maybe 15 to 20 minutes. The provider can see this on the monitor. Without that, without the diary, the provider might be like, okay, why is the patient's heart rate elevated like this in the middle of the night when they're sleeping? Well, if the provider goes ahead and looks at the diary and they see, oh, well, the patient goes to a 24-hour gym and they were doing some vigorous cardio for that 20 minutes, then the math is going to math. It's going to make sense. Now, another thing, the device itself is not waterproof. So we advise the patients do not shower with it, do not bathe, do not jump into a river, a lake, or a swimming pool while you are wearing the monitor. And patients must keep the electrodes on. All right, question number 22. When obtaining a throat swab for a rapid strep test, the medical assistant should collect the specimen from what area? The buccal mucosa, the anterior snares, the posterior pharynx and tonsillar pillars, or D, the floor of the mouth? For question 22, if you said the posterior pharynx and the tonsillar pillars, then you are correct. Now, the posterior pharynx and the tonsillar pillars, this is the only location where strep, the bacteria that causes strep throat, actively lives. Strep bacteria specifically colonizes around the tonsils and basically the back wall of the throat. If your swab never reaches that area, you're not testing for strep. You're just collecting random mouth bacteria. Because remember, we naturally have bacteria all over our mouth, tongue, inside of the teeth, even around your teeth. Now, we talk about buccal mucosa. This is the inner surface of the cheeks. This is actually considered to be part of the oral cavity. And again, it is full of normal mouth flora that have nothing to do with strep. Now, if you hear the term anterior nares, this just means the nostrils. Okay, this is the correct site if you're doing a swab for the flu or even MRSA. All right, question number 23. Which of the following is the primary purpose of applying a tourniquet when performing venipuncture? Is it A, to prevent hemolysis, B, to locate and engorge the veins, C, to decrease patient discomfort, or D, to sterilize the puncture site? For question 23, if you said B, to locate and engorge the veins, then you are correct. So when you tie the tourniquet, remember it has to be 3 to 4 inches above the venipuncture site. We say 3 to 4 inches above the antecubital fossa. Okay. If you're like, well, what is the antecubital fossa? I want you guys to bend your arm. Okay. Our antecubital fossa is around the bend or the crease of our arm. So if we're applying the tourniquet 3 to 4 inches above this site, think of like mid bicep. Okay. All right. Now, question 24. A patient reports experiences orthopnea. The MA should recognize this term refers to what? A, shortness of breath while lying flat. B, dizziness upon standing. C, chest pain after eating. Or D, rapid breathing at rest. If you said A, shortness of breath while lying flat, then you are correct. So if you kind of break the word apart, ortho means upright or straight. Penia means breathing, pnea, right? So orthopnea is a breathing problem that is specifically related to body position. The patient cannot breathe comfortably when lying flat, but it more than likely feels significantly better when they're sitting up or propped on a pillow. All right, question number 25. A medical assistant is instructing a patient on collecting a clean catch midstream urine specimen. Which of the following instructions should be given first? A, begin urinating, stop, then collect the specimen midstream. B, wipe the genitalia area with provided antiseptic wipes. C, place the lid securely on the container after collecting. D, refrigerate the sample immediately after collection. So they're asking for a clean catch midstream. What instruction is given first? Again, first is our key word here. For question 25, if you said B, to wipe the genital area with the antiseptic wipes, then you are correct. This is going to be the first step, and it's the entire reason the procedure is called clean catch. So I want you guys to think of this for a clean catch midstream. And say we have a female patient. I'm going to give her 3 antiseptic wipes. I'm going to advise her with one wipe from the right labia from front to back. With another wipe the left labia from front to back. The third wipe, I'm going to advise the patient wipe from front to back, straight down the middle. That is why it's called clean catch. Now, what other term is in there? It says midstream. So after I give the patient the instructions about cleaning the genitals, then I'm going to advise her to urine a bit into the toilet first, and then the rest into the specimen container. That's why it's called a midstream catch. I'm not catching it from the beginning. You're catching it midstream. Another thing to take into account for a clean catch urine is that the specimen container has to be sterile. Then remember, sterile items are 100% free of all microbes. If it is just a clean cup, there are microbes everywhere, all over every surface. My desk right now, my laptop, all over your areas. Microbes are usually harmless, but sometimes they can be harmful. Clean items can still hold bacteria. So if I gave the patient a clean cup and had her urinate in it, and it came back positive for bacteria, Maybe the patient didn't actively have the bacteria present within her urine, but it was present within the specimen cup. Then the patient could be treated inaccurately and may prescribe medications that she doesn't actively need. So anytime you do a clean catch urine, you have to make sure that the specimen container you give the patient is sterile. All right, guys, question number 26. Which of the following is the correct needle angle for an intradermal injection? A, 10 to 15 degrees, B, 30, C, 45 degrees, or D, 90 degrees. Talked about this a bit earlier, see if you guys remember. But now we're talking about intradermal. So for question 26, if you said A, 10 to 15 degrees, you are correct. Now, an intradermal injection is given into the dermis layer of the skin. This is the layer that's just below the very surface, okay? So to deposit medication into this thin layer, you insert the needle almost completely flat. It's parallel to the skin surface. Now, again, this is a 10 to 15 degree angle. And what we talked about earlier is if you're doing sub-Q or subcutaneous, that is going into the adipose tissue in the fat. Okay, so that's going to be a 45-degree angle. Remember for sub-Q, think about the side of a triangle. Intramuscular IM goes into the muscle. That is a 90-degree angle. Think of shooting a dart. Okay, it goes straight in. There's no tilt to the needle or slant. All right, question 27. Which of the following is a manifestation of anaphylaxis? A, localized rash, B, mild nasal congestion, C, severe hypotension, or D, occasional sneezing. Manifestation of anaphylaxis. So for number 27, if you said C, severe hypotension, then you are correct. Anaphylaxis is not just a bad allergic reaction. Remember that it is life-threatening. This is what we call a systemic emergency. When somebody goes into anaphylaxis, the immune system releases a massive flood of histamine and also other chemicals. Now, these chemicals actually cause blood vessels all over the body to suddenly dilate at the same time. This causes blood pressure to drop dangerously fast. All right. Now, on top of severe hypotension, low blood pressure, the airways constrict and the throat and tongue can actually swell. Patients may break out with hives across their body, their heart may race, and the patient can actually lose consciousness within minutes. It is life-threatening. All right, guys, question number 28. Which of the following is a legal document that allows a patient to outline their wishes for end-of-life care? Is that A, a power of attorney, B, an advance directive, C, a HIPAA release, or is it D, informed consent? Again, outline their wishes for end-of-life care. Now, if you said B, an advance directive, then you are correct. Think of an advance directive as being a living will. Okay, this is the legal term for any document in which a person, while they still have full decision-making ability, can actually write down their wishes for medical care in case they become unable to communicate those wishes later. Think of it as like your pre-planned instructions for when you can't speak for yourself. All right, question number 29. The medical assistant notes that a patient has a hematocrit of 60%. This is the most consistent with what condition? A, anemia, B, polycythemia, C, leukopenia, or D, thrombocytopenia. For number 29, if you said B, polycythemia, then you are correct. Now let's kind of take a look and understand what hematocrit means. This is the percentage of your total blood volume that's made up of your red blood cells. So a normal hematocrit is about 42 to 52% for men and about 37 to 47% for women. So a result of a hematocrit being 60%, whether it's male or female, this means that this patient's red blood cells are significantly elevated and outside of the normal range. When you think of the term polycythemia, this means too many blood cells. Now, what can cause this? It can be caused by bone marrow disorders that actually overproduce the red blood cells. Or it can actually be caused by the body making extra blood cells in response to chronic low oxygen levels. Like think of people that have lung diseases or those who even live at very high altitudes. All right, question number 30. When performing a 12-lead EKG, where should the V4 electrode be placed? Is it A, at the fourth intercostal space, right sternal border, B, fourth intercostal space, left sternal border, C, fifth intercostal space, midclavicular line, or D, fifth intercostal space, anterior axillary line? Now, for question 30, if you said C, the fifth intercostal space midclavicular line, then you are correct. Now, this is the correct placement for the V4 electrode. Okay. Now, precise electrode placement is so important because even small errors in the placement can make the EKG look abnormal and it can lead to a misdiagnosis. When you think of an EKG, I want us to start off by this. I want everybody to make a loose fist. Okay? I know I can't see you guys, but make a loose fist. Your heart is basically the size of a loose fist. Now, your heart pretty much does sit in the center of your chest, but it has a little lean, a little tilt, or a little slant to the left side of your chest. This causes the primary electrical activity to occur on our left side. So when we are talking about electrode placements, V1 through V6, okay, these are what we call chest electrodes. We call them precordial electrodes. Only V1. V1 is the only electrode that is on the right side of the chest. V2 through 6, all of those sit on the left side. Remember, primary electrical activity of the heart is going to pick up on the left side, okay? Now, again, if you guys hear the term precordial, I want you to remember they're referring to the chest. If they say precordial electrodes, they're referring to V1 through V6. If they are saying precordial leads, they are then referring to the lead wires that connect to V1 through V6. If they are referencing limb electrodes, they're talking about right arm, right leg, left leg. Okay? Those are called precordial leads. All right, question number 31. When performing a finger stick, which action helps ensure an adequate blood flow? A, squeeze the finger vigorously. B, warm the site before puncture. C, wipe away the first drop and immediately squeeze hard. D, hold the finger below heart level and immediately massage forcefully. Kind of went over this a few questions back. You guys ready? The answer is B, warm the site before the puncture. Now, blood flows actually through tiny capillaries in our fingertips, and it's actually directly influenced by temperature. When your finger's warm, those blood vessels dilate. They open up a little bit wider, and this does increase blood flow to the area. So after you make the puncture, blood's going to flow freely, and you can collect an adequate sample without having to squeeze or manipulate the finger. Warming methods include using a warm, moist towel that you can wrap around the patient's hand. You can use a warming pack. You can have the patient just vigorously rub their hands together. You can evenly put warm water and tie it off into a glove and have the patient hold it in their hands. If the patient's hands are cold, you are not going to get an accurate reading. So it's going to be warm the site before the puncture. Not that you're not going to get an accurate reading, but you're not going to get an accurate flow of blood. All right. Question number 32. Which of the following is a required element of a prescription? A, the patient's insurance plan. B, the provider's DEA number. C, the patient's social security number. Or D, the pharmacy technician's initials. If you said B, the provider's DEA number for controlled substances, you are correct. Anytime a provider prescribes a controlled substance, this includes opioid pain medications, benzos, stimulants like for ADHD, and sleep medications, the DEA, that's the Drug Enforcement Administration, registration number has to appear on the prescription. All right, question number 33. A patient with a deep laceration is bleeding heavily. What is the medical assistant's first priority? A, clean the wound with an antiseptic solution. B, apply direct pressure with a sterile dressing. C, elevate the patient's legs above the heart. Or D, apply an antibiotic ointment. For question 33, if you said B, then you are correct. Apply direct pressure with a sterile dressing. So when a patient is bleeding heavily from the laceration, stopping the bleeding is the immediate, absolute first priority. Everything else, guys, is going to come after. All right. A medical assistant needs to mail, this is question 34. A medical assistant needs to mail patient records to another facility. Which of the following is the best way to maintain confidentiality? A, place the documents in an unmarked envelope and send by regular mail. B, fax the records without a cover sheet. C, use a sealed envelope marked confidential and a secure mailing method. Or D, email the records as an attachment from a personal email account. Now, from question 34, if you said C, to use a sealed envelope marked confidential and a secure mailing method, then you are correct. HIPAA. Now, remember, HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA protects the patients and their info. So, HIPAA requires that the protected health information, we call this PHI, be safeguarded in every form that it exists. Whether this is electronic, whether it's written on paper, whether you even speak it out loud. When you need to mail that PHI, protected health information, to another facility, the envelope must be completely sealed and clearly labeled confidential so that anyone who handles it knows that it contains sensitive medical information. You need to use certified mail or another track traceable delivery method. This basically just adds on an additional layer of accountability, and it does create a record of where the documents went. Another form is registered mail. Registered mail is one of the other more secure ways to send mail. Another thing that you guys do have to remember for the exam is anytime you send a fax, whether it's to another provider's office, another healthcare facility, or to a pharmacy, anything containing PHI, okay? Again, PHI, I want y'all to remember, stands for what? Do you guys remember what? I'm going to pause so you guys can think about what it stands for. All right, when we talk about PHI, that personal health information, if you are sending a fax, you have to include a cover sheet. Some of you guys may run across something similar. You have to include a cover sheet. When obtaining a throat culture, why should the medical assistant avoid touching the tongue? We have a few swap questions on here today. A, it causes the patient to gag excessively. Excuse me. B, it introduces oral flora and contaminates the specimen. C, it dries out the swab and prevents growth of organisms. Or D, it interferes with the rapid strep region. Now, for this one, if you said B, it introduces oral flora and contaminates the specimen, you are correct. So we've touched base on this one a couple of times today. So this one's a question about specimen integrity, and it is clinically important. The tongue is coated with hundreds of special normal bacteria that naturally live in our mouths. Now, we call this oral flora, or we call it normal flora. These bacteria, again, are harmless in your mouth, but if they get on a culture swab, they're going to grow in the lab culture disc right alongside the pathogen that you are actually trying to detect. So the result's going to come back as normal oral flora or incorrectly identify one of those mouth bacteria as being a causative organism. So we want to make sure that our patient is not diagnosed incorrectly. Question number 36. Which of the following is the correct procedure when measuring an adult's apical pulse? Is it A, place the stethoscope over the left midclavicular line at the fifth intercostal space? B, count the beats for 15 seconds and multiply by 4. C, place the stethoscope at the right sternal border at the second intercostal space. Or D, count only for 10 seconds if the rhythm is regular. All right, if you said A, to place the stethoscope over the left midclavicular line at the fifth intercostal space, then you are correct. This location is what we call the cardiac apex. This is basically the location where you can hear and feel the heartbeat more strongly. Now, another way that you guys may actually see this is they may ask you, how do you take an apical pulse? It is over the apex of the heart, which means that we're putting the stethoscope directly over the heart, listening to the heart sounds. Another thing that you guys need to remember for testing is an apical pulse is the only acceptable method to take a manual pulse on an infant. For adults, what do we use to take a manual pulse? We use the radial artery. The radial artery is the artery that's located on the thumb side of the wrist. think of an infant. Think of how small they are, right? Their little radial arteries are tiny, and you're not going to be able to accurately pick up their pulse. So for infants, if you are doing a manual pulse, you take the bell or the diaphragm of the stethoscope and you put it directly over the apex of the heart. All right, question 37. A patient's lab result shows a potassium level of 6.2. How should the medical assistant interpret the result? Is that A, normal? B, is it critically low? Is it C, elevated? Or is it D, borderline low? Potassium of a 6.2. If you said C, elevated, then you are correct. Now, normal potassium levels are going to range from 3.5 to 5.0. You guys need to remember that, okay? Normal potassium is 3.5 to 5.0. Excuse me, a value of 6.2 is going to be considered to be elevated. It is high. When potassium gets too high, the heart's electrical conduction does become unstable, and then the patient really does become at risk for a life-threatening cardiac arrhythmia. This can include ventricular fibrillation. Okay, so 3.5 to 5.0 is normal. All right, question number 38. Which of the following statements, excuse me, is true regarding HIPAA? A, patients cannot access their own medical records without a court order. B, providers may share patient information with any family member without permission. C, PHI must be protected in any form, electronic, written, or verbal. Or D, HIPAA only applies to hospitals, not outside or not outpatient offices. For number 38, if you said C, PHI must be protected in any form, electronic, written, or verbal, you are correct. This is a foundational principle of HIPAA. Again, remember, guys, I know we said it, but I'm going to say it again. HIPAA stands for the Health Insurance Portability and Accountability Act. And we talked about PHI. Again, remember, PHI stands for Protected Health Information. Now, when we talk about PHI, this includes any information that can be used to identify a patient, and it does relate to their health condition, any healthcare services they receive, or even payment for their care. HIPAA does not make an exception for anything based on the form of the information taken. Okay, good job. Now, question number 39. When preparing a patient for a rectal temp, which of the following is correct? A, insert the thermometer 2 inches for an adult. B, place the patient in prone position. C, use the same probe cover used for an oral temperature. D, no lubrication is necessary. For question 39, the answer is A. You're going to insert the thermometer approximately 1 to 1.5 inches for an adult. This says 2. This can actually reflect some clinical variations. Make sure that you guys do follow your facility specific protocol. But I would say 1 to 1.5 for this one, honestly. When it talks about rectal temps, remember that your patient does not go in prone. They do go into Sims position. Another question that you guys may be asked about a rectal temp is, what is the most accurate method for measuring a temperature on a patient? It is rectal. The most inaccurate method for measuring a temperature is going to be auxiliary. Auxiliary is under the armpit. Okay, so rectal is the most accurate. Patient is going to go in Sims position. All right, question number 40. Which of the following is a recommended action when disposing of biohazard waste? A, place in a regular trash bag if double bagged. B, autoclave before discarding in a designated biohazard container. C, flush liquid specimens down the toilet without treatment. Or D, pour disinfectant directly on solid waste before regular disposal. A recommended action when disposing of biohazard waste. If you said B, autoclave before discarding in a designated biohazard container, let me go back to this one real quick because I think I might have looked at that one wrong. We have an inaccurate. When disposing of biohazard waste. All right, the answer is not B. Okay, this one absolutely 100% is a whole typo on here. Okay. Oh no. I was thinking of biohazard container. Okay. When when we are talking about biohazard waste, okay, autoclaves themselves use high pressure steam to heat and kill all microorganisms, including bacteria, viruses, and spores. We use an autoclave for any instruments that are reusable. If a biohazard waste is disposable, if it is gauze, if it is any type of dressing, your gloves, that is going to go into the biohazard waste bag, okay? You are not cleaning that prior, you're not autoclaving that, you're not disinfecting it or washing it. Any instruments, though, if we're talking about scalpels, if we're talking about non-disposable scalpels, if we are talking about any instruments that is non-disposable, it gets cleaned into the autoclave, okay? If it is a disposable instrument, let's say disposable scalpel, dermablade, lancet, you are not cleaning those off and then disposing of them. You are throwing them directly into a sharps container. Remember, a sharps container is a puncture-proof, spill-proof container, and anything that punctures through a patient's skin is considered a sharp. If it punctures, if it breaks the skin, it is considered a sharp, and it goes into a sharps container. So I do not like this question at all. I don't know how I snuck this one here. But again, any biohazard material that is, let me go back, any biohazard material that is disposable, it goes into a biohazard waste bag. Okay, think of gauze, think of dressing, think of contaminated gloves. If it is an instrument, it's going to go into an autoclave machine. Okay. If it is a disposable instrument that has punctured through, broken through the patient's skin, it then goes into a sharps container. Okay. All right, guys, question 41. Which of the following is the normal range for a fasting blood glucose in adults? A, 70 to 99, B, 100 to 125, C, 126 to 150, or D, 60 to 69. The normal range for fasting blood glucose. The answer is 70 to 99. This is the normal, so that's A, guys. This is the normal fasting blood glucose range, and it's one of the most important lab values to memorize for no matter which exam you are taking for medical assisting. Fasting means that your patient has not eaten or had anything to drink for at least 8 hours. They can still drink water and they can still take their medication. Question 42. A provider orders a hemoglobin A1C test. What does this test measure? A, the average blood pressure over 3 months. B, the average blood glucose over 2 to 3 months. C, immediate postprandial glucose levels. Or D, iron saturation in the serum. If you said B, average blood glucose over 2 to 3 months, then you are correct. A simple way to understand why this test works the way that it does is that red blood cells live in your bloodstream for about 90 to 120 days. Average lifespan for our RBCs are 120 days. So during their entire lifespan, glucose molecules in your blood actually start to gradually stick to the hemoglobin protein that's inside of our red blood cells. Now, the hemoglobin A1C test measures the percentage of your hemoglobin that has glucose attached to it. So because it reflects the entire lifespan of the red blood cells, it gives a basic picture of the average blood sugar over the past about approximate 3 months. You'll see those kind of routine tests that are ordered for patients to have their A1Cs checked are averagely they're scheduled about every 3 months. Okay. Now for A1C levels, an A1C from 5.7 to 6.4 is categorized as being prediabetes. Anything greater than 6.5 is categorized as diabetes. And then an A1C below 5.7 is categorized as normal. All right, guys, question 43. Which of the following is an example of a close-ended question a medical assistant might use during their health history? A, can you describe how the pain feels? B, what makes the pain better? C, do you smoke cigarettes? D, tell me more about when the pain started. It's asking an example of a close-ended question. Now, the answer for this one is actually C. Do you smoke cigarettes? Okay, this is a close-ended question. Close-ended questions require simplistic answers. Yes, no. Okay, you don't need more details. It's just a yes or no. This is where you just want a specific, quick direct piece of information. When you think about open-ended questions, these almost always begin with words like describe, tell me when, explain, what, how, okay? Can you describe how the pain feels? It's not just yes or no. You want the patient to elaborate, right? This is considered to be an open-ended question. Another example, what makes the pain feel better? You can't just give yes, no, maybe so, right? The patient will then have to expand. Well, I tried this or I did this. They need a fuller explanation. This is considered to be open-ended. Again, close-ended, where you just need a quick short answer, yes or no. All right, question 44. When performing a 12-lead EKG, where should the V4 electrode be placed? At the fourth intercostal space at the right sternal border, fifth intercostal space at the midclavicular line, fourth intercostal space at the left sternal border, or fifth intercostal space at the anterior axillary line. I know that you saw this one already, but I want you guys to see this again. The intercostal spaces for the electrode placements, I want you guys to remember this for your exams, okay? The answer is the fifth intercostal space at the midclavicular line. Remember, V1 through V6 are considered to be precordial electrodes. Those are chest electrodes. V1 is the only one that's on the right side of the chest, okay? V2 through 6 are all on the left side. All right, question 45. A patient scheduled for a minor office surgery expresses that she has not signed the consent form and does not want to proceed. What should the medical assistant do? A, continue preparing the room and set up sterile supplies. B, explain the procedure and attempt to obtain verbal consent. C, inform the provider immediately and stop the procedure. Or D, ask a family member to sign the consent form. For question 45, if you said C, to inform the provider immediately and stop the procedure, you are correct. Every competent adult has the absolute unconditional legal right to refuse any medical procedure at any time for any reason, or guess what? No reason at all. If they don't want to proceed, guess what? Again, everything stops. No more setup, no more prep, and no attempting to talk them into it or even pressure them. All right, question number 46. Which of the following vaccines is recommended annually for most adults? Is it A, Tdap? Is it B, influenza? Is it C, Hep B? Or is it D, MMR? For question 46, if you said B, influenza, you are correct. This is the vaccination. This is actually the vaccine on the list that is recommended every single year for virtually everyone that's 6 months and older. The reason that this is so is the influenza or flu virus, it does mutate rapidly. So every year, the strains of the flu that circulate in the population are somewhat or significantly different from the previous year's strands. So public health scientists kind of have studied which strands are likely to be most prevalent for each upcoming flu season. And then they go through and reformulate that vaccine every single year. All right, question 47. Which of the following is the correct order of draw for routine venipuncture according to the CLSI standards? A, red, light blue, green, lavender, gray. B, light blue, red, green, lavender, gray. C, red, lavender, light blue, green, gray. Or D, green, red, light blue, lavender, gray. All right, give me a second. And remember, do not hesitate to pause throughout the video. All right, the answer for B is light blue, then red, then green, then lavender, then gray. Now, I want you guys to remember the CLSI. The CLSI stands for Clinical and Laboratory Standard Institute. Remember that the CLSI sets the standards for laboratory, okay, for a phlebotomy, for the order of draw, for the correct processes and procedures when drawing blood from a patient. The reason that you have to abide by the order of draw is remember that the tubes contain additives. Additives can either be like serum separating or they can contain clotting factors. If an additive in one tube rolls over to another tube, if you are not drawing in the correct order, then the other tube can actually become contaminated and then they won't be able to utilize the specimen. So we have to make sure that we abide by the order of draw. Light blue, red, green, lavender, gray. All right, question number 48. A patient with a history of syncope becomes pale and diaphoretic during venipuncture. What is the medical assistant's next action? A. Remove the needle and lower the patient's head between the knees. B. Continue the draw quickly to finish the specimen collection. C. Call emergency services immediately without removing the needle. Or D. Massage the puncture site to restore circulation. For question 48, if you said A, to remove the needle and lower the patient's head between the knees, what you are seeing is basically vasovagal syncope. This is a fainting response that is triggered by pain, stress, or even anxiety from venipuncture. The body suddenly drops the heart rate and the blood pressure, and this does cause the brain to receive less blood flow, and the patient starts to feel faint or they actually do faint. Okay, what you'll notice is that the patient may appear pale. Their skin may appear clammy or cold. They may even be sweating. These guys are classic warning signs that your patient is about to faint. Get prepared. You want to act before they actually do lose their consciousness. The first thing that you're going to do, remove the needle. Question 49. Which of the following is the primary purpose of using a tourniquet when performing venipuncture? A, to prevent hemolysis. B, to increase pressure in the veins for easier visualization and access. C, to decrease patient's pain. Or D, to sterilize the site before puncture. All right, for question 49, if you said B, to increase pressure in the veins for easy visualization and access, that is correct. Okay. This question is asked twice on purpose because it will be tested repeatedly. You guys will see, maybe you were like, wait, I heard this question earlier. And you may see that we did a couple of questions that were phrased a little bit differently, but we're asking the same concepts. What you guys will find on the actual exams themselves is that you may have one, two, sometimes even three questions that could be referencing the same thing, but maybe they may switch up the verbiage on you. They may be phrased a little bit differently. Okay. The reason that you guys see things were tested repeatedly that I kind of want to review is I want you to avoid traps in the wrong answers. Um, they set these to kind of specifically catch students who do not know purpose well or who don't use their critical thinking, right? Like, oh, I seen this question 10 questions back. Maybe that one was wrong. No, guys, 9 times out of 10, your first choice is right. Trust yourself and trust your instincts. All right, so this one is when you apply the tourniquet 3 to 4 inches above your intended puncture site. Remember, 3 to 4 inches above the antecubital fossa, or we even say antecubital space. That is by the bend or the crease of your arm. 3 to 4 inches is going to put you about midway on the bicep. Okay. This basically increases the pressure in the veins and it gives for ease because it builds that pressure. It gives easier visualization for us to be able to identify and find the vein so that we get a smooth stick. All right, question number 50, last but not least, which of the following is an example of a legally reportable condition? A, hypertension, B, chickenpox, C, seasonal allergies, or D, migraine headaches. If you said B, chickenpox, then you are correct. Now, certain infectious diseases are legally required to be reported to the state and local health departments. Then they in turn report them to the CDC. This is what we call mandatory reporting, and this exists because these type of diseases have the potential to spread through communities and cause outbreaks. And public health officials need to be able to track, to investigate, and also to respond to them quickly to protect the population. Varicella, which is also chickenpox, is on this list because it is extremely contagious. Yes, you can get chickenpox from skin to skin contact, but a lot of people don't even realize that chickenpox is airborne. All right, you guys, we did 50 questions today. You guys did great. You guys did absolutely great. This is going to be a wrap on today's review. I am going to start posting more reviews weekly. I've also been asked about doing lesson reviews. If you guys haven't checked it out, I did do one on infection control. I'm also going to start doing those a bit more as well. I do hope this session helps strengthen your understanding and give you guys just a little bit more confidence going into your exams. I do want you guys to remember, though, that passing the exam isn't about knowing every single fact. It's going to be about understanding the concepts, you staying calm, and just trusting what you've learned. If you missed any questions today, do not get discouraged. Those are actually the questions that help you grow the most. Go back, guys, review the topics, and keep practicing. Some questions you may have seen a bit repetitiously. High yield concept areas. Remember, guys, go back, pause in between the questions so that you guys get time to think your answers through, then press play. I do want to say thank you guys so much for spending your time studying with me. If this review did help you, be sure to give the video a thumbs up, subscribe if you haven't already, share it with another future medical assistant who could use a little bit extra support. If you guys are looking for extra support, please check out passmawithdanny.com. There you will find modules for every test area covered, as well as notes, slides, flashcards, quizzes, cheat sheets, study guides. There's just an abundance of resources and materials, as well as 10 100 question practice exams, all with rationales. There's also a 200 question final with rationales. There's also a community on there where we can kind of communicate and talk with one another. All of the quizzes and the mock exams are unlimited attempts. So, that's something you guys are interested, definitely check out passmawithdanny.com. Another thing that I do want to throw out there for you guys too, just some testing advice. Throughout middle school and high school, you guys are told go back and check your answers. Don't submit your test until you have checked every single answer. I want you guys to unlearn that. And I want you guys to totally disregard that. Do not go back and check your answers. I want you to trust your first instinct. Go with your first mind. 9 times out of 10, you guys got it on the first go. It's when you go back and you start rereading and re-reviewing, you start second guessing yourself and you start second guessing what you know. You might have put B and then you go back a second time around and was like, oh, I put B, maybe it's C. And then you're like B, C, B, C. And like at the end, you're like, I'm just going to go ahead and change it to C. And it was B the whole time. Trust your first instinct. Another piece of advice that I can give you guys is do not spend longer than 60 seconds on a question. Read the question. If you're stuck, if you're unsure, take your best guess. Flag it. Okay, flag it. I want you guys to run through all of the questions that you're confident with, all of the questions that you know. And by the time you get to the very last question, your flag questions are going to pop up before you submit it. And then you guys can look at your clock, your timer, and you can see how much time you have left. And you can spend the remainder of your testing time going through those flagged questions. All right, guys, it's been an absolute pleasure. I'll see you in the next review. Until then, guys, keep studying, keep believing in yourselves, and just as always, just know that you got this. See you guys next time.